Jerome Mayhew.
Thank you, Madam Deputy Speaker. As I was saying just a moment ago, it would be all too easy to focus a speech on dentistry on a call for the renegotiation of the NHS dental contract, because every Member of Parliament will know from their postbag the suffering being experienced by ordinary people every day because they are simply unable to see a dentist. The pandemic has caused the loss of 40 million dental appointments, more than an entire year's worth of standard pre-COVID treatment. But COVID is not the cause of our problems. Ever since Labour imposed its NHS dental contract on the profession back in 2006, trouble has been brewing. Dentists have been voting with their feet, moving in their thousands away from NHS treatment to private work, and this trend has only accelerated through COVID. It's between the start of the pandemic and May 2022, 3,000 dentists have stopped doing any NHS work, and three-quarters of those who are left say they're likely to reduce their coverage further over the next year. So this is a problem that we simply cannot ignore any longer. The pain and suffering is too great. Labour may have created this bad system that fails to pay for the cost of complex work, but it is our job to fix it, and the sooner the better. However, Madam Deputy Speaker, the purpose of this debate is not to moan about the state of NHS dental provision, it's to put forward a positive case for solving the long-term problems in Norfolk and the East. Put simply, we have a desperate shortage of dentists of any description. Too few dentists, too few dental technicians, whether NHS or private, are choosing to work in East Anglia. Nationally, the General Dental Council says that we have more dentists than ever before, with an average, a national average, of 43 dentists for every 100,000 of the population. But in Norfolk and Waveney, that figure is just 38. Now, that's the fifth lowest ratio of the 106 clinical commissioning groups around the country. Dental practices are crying out for new staff, but they simply cannot get them. Now, in my constituency in the town of Fakenham, I lobbied successfully for the NHS to award a brand new NHS dental contract to increase local NHS provision. This was the government being prepared to pour new money into increasing NHS provision. But when that contract was advertised, not a single company bid for the work. There simply wasn't the staff to supply the need. And it's not just an NHS issue. In the same town, a private dental practice has been advertising for 2 years for a private dentist, but without success. You then go into North Norfolk. There's a dentist in Sheringham, in my honourable friend, the member for North Norfolk's constituency, who operates practices both in London and in Norfolk. Now, he has not had a newly qualified dentist come to work in his Sheringham practice for 10 years. Job vacancies in London are snapped up, but he simply cannot get them to take the jobs in Norfolk. Why is it that we cannot produce dentists in East Anglia? The answer is because there's nowhere for them to train. If you want to become a dentist and you live in East Anglia, the nearest place you can train is Birmingham or London. Of the 10 training facilities around England, none of them are in the east of England. This has to change. We know from our experience with the University of East Anglia that graduates tend to stay and build their lives close to where they have studied. The UEA does a survey each year of their graduates to see where they go on and accept their first employment. Now, if you look at that survey for doctors coming through the medical school of the University of East Anglia, more than 40% every year end up taking jobs locally. Now, that's great for us, for doctors, and particularly for the Norfolk and Norwich University Hospital based in Norwich. But the same problem is unfortunately true for dentistry. Just look at the number of dentists working near to existing dental training schools. Norfolk, as I said a moment ago, has 38 dentists per 100,000 of the population. But Devon, which is sort of broadly similar as a county, it's a largely rural county with coastal communities with one major conurbation in Plymouth. The big difference, though, is that Plymouth has a dental school installed since 2005. Its ratio of dentists per 100,000 of population isn't 38, it's 49.6. Look at the northeast. With the school in Newcastle, their ratio of dentists to general public is 56. Cheshire and Merseyside, they have a school in Liverpool, so the whole county there benefits from 58 dentists per 100,000 of the population. We can see from this data, this hard data, that people tend to settle down where they've trained. So if that's the data, Madam Deputy Speaker, surely the solution to the East Anglia's problems is obvious. Firstly, we need to open a dental school in East Anglia. I raised this need directly with the University of East Anglia some months ago, and I've been enormously encouraged and impressed by their response, strongly supported by the NNUH, the region's training hospital. The University of East Anglia has developed an innovative solution to our dental training problems that would minimise costs and get students out into the workplace from the start of their training, helping with capacity in the short term, as well as dealing with the training deficit in the long run. I will, with pleasure.
Honourable friend, give away. As a Suffolk MP, I welcome the idea of an East Anglian training centre. But I also want the University of Suffolk to also play a role. Just recently, it's outlined its plans for a Suffolk Centre for Dental Development. Does my honourable friend agree with me that actually a dental training college in Norwich could work hand in glove with this new centre in Ipswich to make sure that people are trained locally, but then, when needed, are pulled to provide services on the NHS for our constituents?
I'm very grateful to my honourable friend for that intervention, and I agree entirely with him. I think there's collaboration to be had between the university in Norwich and the university based in Ipswich, the University of Suffolk, based in Ipswich, where you can start training in Norwich, and then once qualified, you can have career professional development taken care of by the proposed unit in Ipswich. And I'll come on to that in some further detail in a moment. So returning to the plans of the University of East Anglia, their idea is that students would work in the community for at least one day a week throughout their 5-year training course. In this way, dental students will increase the capacity of associated NHS practices right from the get-go. Too often, there's a suggestion that a dental training school is too long-term to solve the problems of now. And in a sense, of course, it is. But under this plan, we'd have increased capacity right from the first year of their 5-year course. And it has more benefits as well, because students will be increasing the capacity, but they'll also develop employment relationships locally, increasing their stickiness, and provide training income to stretched NHS practices. And it's for this reason that MPs from North Norfolk, North West Norfolk, Mid Norfolk, South Norfolk and Norwich North all support this. And if there were a constituency for East Norfolk, I'm sure they would support it as well. I will give way.
Thank you. I speak as an MP with a foot in both camps. I'm a Suffolk MP, but I'm also represented by the Norfolk and Waveney Integrated Care System. Would my honourable friend agree, as I think my honourable friend from Ipswich has said, that it's very, very important that the two proposals being put together by the University of Suffolk and the University of East Anglia are collaborated and work together so they come through with a solution for the whole of East Anglia?
I'm grateful to my learned friend. The only phrase that I pick him up on is that you have a foot in both camps. I don't think there should be two camps. I think this is an East Anglian solution where the proposals are complementary and in time should both be implemented. Yes, I will.
I'm very grateful to my honourable friend and neighbour for giving way. Could I commend him for raising this and highlight that in his area of mine, many of us are experiencing huge pressures in the dental service on the ground, many of our constituents struggling, and this proposal would both make our region a leader in the science and technology of dentistry, but also help to meet that demand and need on the ground, where, particularly with new housing, pressure that's only going to get more acute in the next few years.
My honourable friend is entirely right. There is a further point to be made about the collaboration between the University of East Anglia and the Norfolk and Norwich University Hospital, because they also have the Norwich Research Park co-located, particularly the Quadram Institute, whose sole focus is world-leading research on the gut microbiota. Now, I can't pretend to know exactly what the gut microbiota is, but I do know that it starts with the mouth. And there is a huge capacity for research, proper hard research in this area that could be assisted by a dental training school in Norwich. So that's Norwich. That's the first solution. The second solution, also needed, is that a dental school in Norwich could then complement the plans of the University of Suffolk to build a centre of dental development in Ipswich. Now, this would support further career development within the region, both attracting and retaining newly qualified dentists. These are plans that have been pushed by the honourable members for Bury St Edmunds, Waveney and Ipswich, amongst others. The truth is, Madam Deputy Speaker, that we need them both. Short-term attraction of qualified dentists, as well as the long-term solution to the wider training problem. It may be that nationally there is an assessment that there's no need for additional dental training seats, but people are human. We have to look beyond the empirical analysis and recognize that training needs to be offered in locations of real shortage. That location is East Anglia and Norfolk in particular. Madam Deputy Speaker, as a Conservative, I believe that people should have power over their own lives, that communities should not be dictated to by national government, but rather be empowered to come up with their own solutions to their local needs. We know what the problem is, and we have a solution to fix it locally. We just need government to trust the people to let us get on and do it. We simply need more dentists and dental technicians in East Anglia. We recognise that budgets are tight and that timings may have to be stretched. We accept that in politics, short-term fixes are sometimes more powerful arguments than long-term solutions. We simply ask that the Minister agrees to meet with the University of East Anglia team to learn firsthand how we can make East Anglian dentistry better and for him to be inspired by their practical vision.
I can't quite tell if the honourable gentleman wishes to contribute.
I will very, very quickly, Madam Deputy Speaker, if you'll give me the opportunity. My honourable friend has set out
Peter Aldous
has set out a great vision of the future, where East Anglia, Norfolk and Suffolk is high-quality dentistry schools. That's great. But we need a bridge to get to that future, because the two medical schools, dentistry schools, will take some time to set up. Would he not agree with me that we need to look at the other strands to address the crisis in NHS dentistry in East Anglia, which includes recruitment and retention in the short term, making it easier for those from overseas to come and work in local dentistries, contract reform, as I think he's referred to, a fair long-term funding settlement, a focus on prevention and improved local accountability through the fledgling integrated care systems.
So, no, perhaps it's my confusion. I thought the honourable gentleman had... so now the honourable gentleman is intervening upon the honourable gentleman. That is absolutely fine. Mr. May.
Well, thank you for that clarification, Madam Deputy Speaker. Would my honourable friend agree that all of those are very important, but there's perhaps one other proposed solution which he hadn't mentioned, and that is, just as we've learnt today that there are inducement payments for teachers in special areas where they're struggling to recruit, perhaps we could apply the same approach to dentists in special areas where we're struggling to recruit.
Yeah. I thank my honourable friend for that intervention. I apologise for hijacking his debate. But in answer to his question, yes, I would agree wholeheartedly on that. This is a multifaceted challenge. There is not one solution. There is not one golden bullet. and we need to be addressing all these particular points, and he is right to raise that particular one.
Oh, so.
Thank you, Madam Speaker. I rise very briefly as former Minister for Life Science and former Minister for Science and Research to highlight the point that my honourable friend was making about the microbiome and the mouth, the buccal cavity, as a primary diagnostic for our understanding of the role of the biome and gut flora and fauna in both good health but also in infectious diseases like cancer. So this is a diagnostic tool as well, and it would make our region a leader in the diagnostics of the digestive system and the gut biome, which has a whole bunch of other very important secondary health benefits. And I, for that reason, commend my honourable friend's case to the ministers on the front bench.
Minister Wilkwitz.
Well, thank you, Madam Deputy Speaker, and let me start by congratulating my honourable friend, the member for Broadland, for securing this debate on the potential merits of establishing a dental training college in East Anglia. And it is absolutely clear, Madam Deputy Speaker, that he has support from not just his neighbouring MPs, one of whom I know cannot be here this evening, but very much supports this endeavour, and colleagues from further afield across East Anglia. I'd also like to thank my honourable friend for raising the issue of access to dentistry in rural and coastal areas, and in particular the challenges of seeing a dentist in Norfolk. As the new Minister for Dentistry, I understand that areas across our country have faced difficulties with recruitment and retention, as my honourable friend highlights, including, of course, in my honourable friend's constituency of Broadland and more widely in the east of England. And these challenges have a significant impact on the provision of NHS dentistry and, of course, patients' ability to receive NHS care. Now, my honourable friend is right to say that we cannot ignore this problem, and I can assure him that it is a priority for me and the Secretary of State. And I very much hope, Madam Deputy Speaker, that it will not have escaped my honourable friend's notice that dentists are a key element of the Secretary of State's ABCD approach and in our plan for patients. Now, I'm also aware that my honourable friend previously attended meetings with my predecessor, I think even my predecessor's predecessor, alongside my honourable friend for North Norfolk, to discuss the construction of a dental school in Norfolk. And I have to say, Madam Deputy Speaker, that it is testament to my honourable friend's character that just days following my appointment as a DHSC Minister, he brought this issue to my attention. His constituents, if I may say, are fortunate to have such a passionate and, dare I say, persistent advocate in their corner. Now, my honourable friend set out in his speech to make a positive case for doing something about a long-term problem, and I think everyone in the chamber this evening would agree that he has done that. Now, my honourable friend makes the case for a new dental school in Norfolk, a case which I know has the backing of my honourable friend, as I mentioned, the member for North Norfolk, who couldn't be here this evening, and on the face of it, it is a compelling case and one worth further exploration. Now, my honourable friend knows me well enough, I think, to know that I am not someone who likes saying no to parliamentary colleagues, although sadly that is a responsibility, Madam Deputy Speaker, that all too often comes with this job. On this occasion, it is a no, but it is a no for now, and let's very much keep talking. And let me explain why. Establishing a new dental school takes several years and would not influence service provision in the short term, which my honourable friend rightly identified. And notwithstanding the strong case that my honourable friend makes, it also does not guarantee ongoing sustained retention of dentists or wider support staff in the area. Our focus is not just about training more dentists, as important as that is, but about the better use of the full dental team and the progression and retention of all dental care professionals within the NHS. Now, there is, of course, an argument about the medium to long term, which is why I suggest we keep talking. And as my honourable friend requests, of course, I would be delighted to meet with him to discuss his ideas and plans further. However, Madam Deputy Speaker, what I would like to touch on, and this has been mentioned by my honourable friend, and indeed my honourable friend, the member for Waveney and Ipswich, is there is also an alternative training model, and that's called Centres for Dental Development, which was identified by Health Education England in their 2021 Advancing Dental Care Review report. That is a a mouthful. But the Centre for Dental Development model would specifically benefit local authorities, or localities, where there is a shortage in provision and no nearby dental schools, as my honourable friend rightly pointed out, the case for East Anglia. Now, the premise is that the centres would build on any existing dental infrastructure in the area, bringing together training and the resultant provision of NHS treatment to patients in a coordinated way. So things like postgraduate training opportunities are more likely to be compatible than early undergraduate placements, which would in turn increase access to more complex and specialist care, which we know is the care that often is most lacking in certain areas of the country, otherwise known as dental deserts. Now, this would work towards the Advancing Dental Care Report's aims to produce a skilled, multi-professional oral healthcare workforce which can best support patient and population needs within the NHS. Now, a further advantage of the Centres for Dental Development model is that they would be tailored to suit the local workforce requirements, in addition to the education and training needs for the area, so contributing to stronger multidisciplinary dental teams and local area workforce retention. Now, given that the Centres for Dental Development would focus on postgraduate training for those later stages, or indeed the later stages of undergraduate training, they could provide support in transitions from undergraduate to dental foundation training and more specialised training beyond these, all of which are really important decision-making moments in terms, as my honourable friend mentioned, those decision-making moments in terms of career development for a dentist and where they're likely to base their career and practice. And having a broader range of placements across the country and in different clinical environments would enhance, we believe, the student experience. And these centres could offer a constructive alternative to dental schools whilst acknowledging and addressing recruitment, retention and training gaps. Now, I'm sure my honourable friend will be pleased to hear that Health Education England have now moved into their 4-year implementation stage through their Dental Development Education Reform Programme, another mouthful, following the Advancing Dental Care Report and its recommendations. Now, my honourable friend rightly raised collaboration, and he's absolutely right to do so. With regards to establishing a Centre for Dental Development in East Anglia, I'm aware, and it's been mentioned by my honourable friend and others, that the University of Suffolk and the NHS Suffolk and North East Essex Integrated Care Board have announced plans for a Centre for Dental Development in Ipswich. And I'm informed, this also covers my area, Madam Deputy Speaker, so I do have an interest in this too. I'm informed that the initial plans include proposals to offer postgraduate educational opportunities as well as wider training opportunities for newly qualified dentists, alongside the training of dental therapists, hygienists and dental technicians who form an incredibly vital part of the dental workforce. And I want to pay tribute, Madam Deputy Speaker, to our members for my friends for Waveney and Ipswich for the work that they have done alongside the Integrated Care Board to push very strongly for this. And I have to say, the Integrated Care Board is a real trailblazer in this area. It would also be wrong, Madam Deputy Speaker, at this juncture not to pay tribute to my honourable friend, the member for Bury St Edmunds, who has not only pushed so very strongly for this, but has also a much missed, dare I say, Minister at the Department for Health and Social Care, because she has such a passion for dentistry and within the department really did put it on the map, a legacy I intend to continue. So, I would very much encourage my honourable friend to meet with the NHS and HEE regional teams for his areas, as centres for dental development are very much a local solution tailored to the existing infrastructure and needs of an area, and I and my office would of course be delighted to help facilitate such a meeting. And I mentioned integrated care systems and integrated care boards. As we transition to integrated care systems, as my honourable friend the member for Waveney pointed out, commissioning roles for dentistry are going to be delegated. So this will ensure that dentistry decisions are looked at a local level, taking into account, for example, local workforce as well as local population health requirements. So I therefore encourage my honourable friend to meet with the Integrated Care Board. I'm sure he's done so already, but I think an ongoing dialogue would certainly make sense, to discuss their plans further and how this will impact Broadland and, of course, the rest of East Anglia. Now, my honourable friend also touched on recruitment and retention. I know this is a particular issue in my honourable friend's constituency. but broader too. In addition to the changes we've made on a national scale through the system reform, NHS England in the East of England region have also been working really closely with the organisations that train dentists to improve the recruitment and retention of dentists in East Anglia, and will continue to support those training organisations to develop the dental workforce. Now, I'm pleased to say that in 2021-22 there was an increase of some 539 dentists performing NHS dentistry compared to the previous year. In the East of England, that was a 3.5% increase, so some additional 105 dentists. But as my honourable friend pointed out, it's just not enough, and we need more dentists, and we need more dentists performing NHS contracts. More broadly, I know my honourable friend will want to know what improvements are being made now. What improvements are being made now which will improve access to dentistry for his constituents. He rightly focused on the medium to long term, but I know from my postbag the pressing concern is often the here and now, Madam Deputy Speaker. We plan for the dental system improvements announced on the 19th of July as part of our plan for patients to begin to take effect by the end of this year, and some of the improvements in the package have already taken effect and are beginning to bear fruit. Focusing, if I may, on recruitment and retention, I know this is a key concern of my honourable friend and others. The Secretary of State and I are also looking at a number of other measures that we can take to aid recruitment and retention. My honourable friend may have touched on one of the ideas that we are looking at to improve recruitment and retention, which in turn will improve access for constituents. And as I've said, this is a top priority for me, and I hope to share more detail with my honourable friend and others, and of course the House in due course. In conclusion, Madam Deputy Speaker, I am committed to playing my part to improve access to NHS dentistry, particularly of those most in need of dental care, and I know that recruitment and the dental workforce will play a pivotal role in this. And I hope my honourable friend has been reassured that action is being taken to address the challenges in recruitment and retention across the country, in particular in his constituency. And I very much look forward to working with my honourable friend as we develop our ambitious plans, and know that he will continue to be a champion for his constituents and hold the government's metaphorical feet to the fire as we deliver the improvements to dentistry access that we all want to see.
Thank you.